Hello. Hi, my name is Dr. Hisla Bates, and I'm a psychiatrist. I'm also a coach, and I talk a lot about creativity and art. And some of you may be wondering, why is that? That maybe doesn't make sense or it doesn't go together. Well, let me tell you a little bit about me. So, if you haven't listened to my podcast, please listen to the podcast. It's called Heal Yourself, Reduce Burnout, Discover Your Creativity While You Heal Others. And I guess that sort of describes my story, my journey. I was a fashion designer and I went to Parsons School of Design. And so I learned how to draw the figure and design clothing, and it was wonderful training. And I did that before I became a doctor. I always wanted to be a doctor and just decided, you know what, that's my calling and I'm going to go for it. And so I went back to school and ended up in medical school and residency. And when I did that, I left everything that I knew about design or drawing or art. I kind of left it on the back burner. I did not think that it was appropriate or valuable or needed or necessary. I felt like I didn't have time, and so I did very little. I would enter art shows every now and then, and we had an annual art show, so I would draw somebody or something. And sometimes during anatomy, I would draw out the organ systems so that I could remember them. I found that when I drew things out, I was able to remember them better. And that is still the case and still very true. Research has shown that if one draws something out, you're more likely to remember it. And that's also true for patients. If you draw out whatever it is you're trying to describe or explain to them, that they will remember and retain it better. And it also engages them. And so you're going to get better compliance in general. So this is how art can benefit you in your medical practice. So anyway, back to me. So I put art on a back burner and I didn't really do anything involving the arts. And I had this yearning. It was like this inner yearning. My soul just wanted to paint. So I started buying the work of other artists. And I spent a lot of money on other people's art until finally my 9-year-old at the time said, "Mom, I think you can do this. I don't think you need to buy this painting." That was a painting that I loved. It had 4 or 5 houses on the bottom. It was really simply painted and drawn, but I loved it. It appealed to me, and it was $10,000. It was huge. I mean, the price was huge for me. I had no business even considering it, but I fell in love with this work of art. And my daughter said, "Mom, you could do this." So anyway, I thought about it. I didn't buy that painting. And at the time I was living in Arizona, but then I moved back to Boston. And I connected with a group of artists and I started to paint. And I loved it. It was wonderful. I started painting and doing printmaking. And I'd never done any of that before. I remember walking into the studio and the palette was out for me. There were all these colors of paint. And I said to the person who ran the studio, "I don't know what to do. I don't know how to mix these paints. I've never worked with oil before." And she said to me, "Oh, don't worry about it. Just go ahead and mix them and, figure it out. You can do it." I didn't think I could do it, but then I ended up mixing colors and I was looking at a photograph and trying to get the colors that I saw in the photograph. And a lot of it was intuitive. I didn't even know that I had that skill. and I started to discover things about myself. And I just started painting and printmaking. And then I noticed that I was happier. I was really happy. But I think the real turning point was when I got very sick. I had valley fever. I don't know if any of you know what that is, but I was in Arizona biking in a dust storm, and that's how I got it. And I got very sick. So sick, I thought I was going to die. And I called up my physician and I said, I can't breathe. Felt horrible. Went to the ER and I said, I think I have valley fever. Meanwhile, I had researched everything and they didn't think I had it. And there was a lot of debate, and I saw a lot of different doctors, and I had to beg them for treatment because no one believed that that's what I had. And so the reason I'm telling you this is because this was a real turning point for me. I finally got treatment, finally consulted the University of Arizona to get the diagnosis and exactly what treatment I needed. And I took photographs of myself. Anyway, when I felt better, I went back into the studio and I started painting. And I did these drawings and paintings of me from the photographs. And when I left the studio that night, I felt free. It was the most cathartic experience I had ever had. I felt like all of that angst and distress and pain and frustration with the medical system, all of that just came right out and onto the page. And I'm gonna show you those paintings so that you can see them. And those paintings were a representation of the release that I felt. And I realized, wow, art is really powerful. It's really powerful. If I could feel this different by putting something down on paper, this is powerful stuff. And I started to have a tremendous amount of respect for what art could do for me. So that's kind of how this all started. And then I realized, this is powerful stuff. And I'm going to share it with patients, and I'm going to share it with as many people as I can. It became a source of recovery for me. It became a source of relief. And I used to paint a lot of houses that were falling down and dilapidated and broken. And I'll post some of those too so that you can see them. And then I found out about the metaphor of the heart, that the heart is like a home, and it has chambers, which are rooms. It has doors like valves that open and close. And I realized in retrospect that some of those houses that I had painted were actually broken. And my heart was broken, and they were a representation of how I felt at the time. I was going through a pretty tough time. And so I think that you can actually get your emotions out on the page, and you might not know or realize what emotions are actually there until you gain some perspective. And that's really powerful. But then there are other things that are so amazing about art as well. Like the fact that there's graphic medicine where people are telling their stories using illustrations and storytelling. art can be a source of storytelling. And there's, of course, there's art therapy, which we know is extremely helpful to those who are experiencing trauma or who have experienced trauma. When 9/11 happened in New York, it was art therapists that came to the rescue. When Haiti had the earthquakes, it was art therapists who went there and helped a lot of the victims paint murals and art related to their experience and to relieve their stress and trauma. Art is a way that we can release our stress, and it's a way that we can heal each other. And as physicians, I think it's a useful tool. There are also some areas in which people are using art as a way to beautify scars. Women who've had mastectomies, sometimes they get tattoos where their breast once was, that are a beautiful flower, a beautiful remembrance of the journey that they've been through. Others are using henna to tattoo their bald heads after chemotherapy. Art is being used in many wonderful ways, and a lot of physicians in Britain or the UK are actually prescribing art in prescription form. They're writing prescriptions for patients to go to art galleries and museums because it's been shown that it's beneficial to go into an art gallery or a museum, that those spaces, which are very welcoming and beautiful, the actual act of just looking at a beautiful piece of art is a wonderful way of it's a wonderful way of experiencing art. And so this goes back to art as a form of communication. It's a form of communication, and it's a way in which we can experience something. So when you look at a piece of art, oftentimes it conveys an emotion of some sort, an emotion that you might feel. You might look at a painting and think, oh my goodness, that image makes me sad, or that image makes me angry, or that image, I just want to immerse myself in it. It conveys a feeling, and the feeling is different for everyone. But that feeling is a way of connecting. So you sometimes, when you hear the artist's story, you can also connect to that artwork as well. So there are many, many ways in which we can appreciate art. And then, of course, there is the expressive arts like comedy, there's poetry, the spoken word, storytelling, drama, acting, screenwriting. These are all forms of art that are ways in which we can express ourselves. And then there's also, I was a fashion designer, and there are ways in which we can express ourselves by the way we present ourselves, the way we put clothing together, the colors we choose to put together, and so on. So I want you to look at art as a way of communicating, a way of being, a way of expressing yourself, a way to find joy, a way to recover, a way to connect. And I want you to learn how to utilize art for your benefit, for your well-being, to lower your stress, and to create. So thank you for listening, and I hope that you have made some discoveries. And I will post some of the photographs of my artwork so that you can see it. And, and yeah, thank you for listening.